I would like to welcome Professor Dr. Alain Labrique, who is one of the foremost innovators in mHealth solutions in the world right now. Dr. Alain Labrique is joining us from USA. So I would like to ask Dr. Labrique, what does it take to scale innovation?
Good morning, everyone. I hope you can hear me well. Assalamu alaikum. It's really a pleasure to be with you at this momentous occasion. I've seen amazing things happen in Bangladesh over the past 2 decades, as I've been working closely with colleagues there and with the Ministry of Health. And I'm going to share my screen, if I can do that, and let me know if this works. But my greetings to all my fellow panelists here. Just give me one moment and let me know if everything works. So yeah, it's a pleasure for me to be with you this morning. I apologize if I'm a little less than lucid. It's 5:30 or 6 in the morning. So as someone who has to work very late into the night, sometimes early mornings are a novelty for me. So a pleasure to be with so many of you from around the world, and I look forward to sharing a few of my thoughts over the next few minutes. So it's really been a privilege for me to lead a number of global digital health and mHealth initiatives, and work closely with the World Health Organization on a few recent milestones that have really marked the landscape of digital health. So in the next 20 minutes, it's important for us to consider why it is important to think about digital health and invest in digital health innovations, because as much progress as has been made in the last 2 decades, there will still be around the world 10 maternal deaths in the next 20 minutes. There will be roughly 24 deaths among children under 5 years of age, which is the equivalent, if as many of you recognize, of a Boeing 747 crashing filled with new mothers and children every 1 to 2 weeks. And I think this is the driving force, at least for me, when I wake up every morning, to think about why we are trying to harness the power of digital health. Let me make sure you can see my screen, and I think that's working. Zaki, if you can't see, just please do interrupt me. But why we have to harness the power of digital to try and accelerate our progress towards the new Sustainable Development Goals and other global targets that have been set by Bangladesh and by countries around the world, including many of you who have joined this webinar today. This is unfortunately what the map of the world looks like when you inflate the boundaries of the countries that contribute the largest proportion of neonatal and maternal mortality and other health indicators, where we start to see the boundaries reflect the proportion of that global burden borne by these particular countries. And I had these statistics are not just statistics, because I myself was born in Bangladesh many years ago, shortly after the ferocious liberation war. And my mother and I almost became statistics as I suffered from obstetric complications and neonatal distress. So these not only are statistics, but they take on a very personal meaning to me. Over the past 20 years, I've had the privilege of working in northern Bangladesh, as well as across the country, specifically with the Javita Maternal and Child Research Site, where we've been following a population of... Sorry, if your microphone is on, would you mind turning it off?
I think, can you...
Thank you so much. So we've been following roughly 500,000 people for the past 20 years in a series of large-scale studies, working closely with the MOH, BMRC, IPHN, and other colleagues within the country to identify ways of reducing neonatal mortality, maternal mortality, but especially trying to improve quality of life, nutrition, and growth as well in these communities, including the coverage of essential services such as vaccines and newborn care. So these 850 staff have been devotedly conducting these kinds of high quality research in the field, and working closely with their government counterparts to try and test innovations that could accelerate coverage and quality of care in rural populations, not just in Bangladesh, but across the greater Gangetic floodplain. Over the past 20 years, we've been able to disseminate over 100 scientific publications that have supported both national and international policy in digital health. So while we've been doing this research, I was actually very, very privileged to observe what I like to call the mobile phone revolution taking place. And what you'll notice, as this map illustrates, the same countries and the same parts of the globe that bear the burden of excess morbidity and mortality are the same countries where we face the opportunity for innovation using digital, because these are the countries that have taken the leadership and primacy in mobile phone coverage, penetration, and access to digital technologies that we in the health sector must believe in harnessing to strengthen health systems. So the definition of what is remote and rural has changed dramatically over the past 20 years. And now access to information, access to people, and our ability to share information with populations and health workers and connect those who were formerly disconnected has changed radically. And this is why we must be changing our thinking about digital in the use of health system strengthening, as Bangladesh and many of you on the call, your countries have done as well. What's important to note is some skeptics will point out the gap, the digital gap that still exists, and I will question this to some extent, because when we look at mobile phone ownership in rural Bangladesh as far back as the early 2000s and mid 2000s, we can see that the pace of penetration and access to mobile phones has really been transformative across socioeconomic groups. And this is data coming from the Jivita research site, suggesting a rapid closure of that gap, irrespective of wealth index. The other thing we noticed back in 2010, so this is about 8 years ago, is that even in the early days of the mobile revolution, people were using mobile phones to make emergency health decisions. Whether it was to call a provider or arrange transport or medical advice, mobile phones were being disruptive in the status quo of healthcare. We tried some audacious things, whether women could notify health sector workers shortly after birth, because in conditions where home-based deliveries still are far too common, it's essential that we know a birth has taken place so that qualified government workers can show up at the home and deliver the essential newborn care that we know can save lives. And we were able to demonstrate about 90% of the time we were notified that a birth had happened so that this early response could take place. So these gave us the courage to launch what we call the mCare 2 project, working closely with the Ministry of Health, DG Health, DG Family Planning, and the World Health Organization to test innovations that have been really powered by our colleagues here at Empower as part of a global consortium of programmers to develop a new open source global good called OpenSRP, now under trial in the district of Gaibandha, where we have just completed 12,000 births registered in these systems. So the pathways to scale up, this software is being used now in Tanzania, Zambia, and a number of other countries for routine service delivery as well as immunization programs. What's most exciting is that in the pilot phase, we demonstrated the capacity of these digital tools to dramatically improve coverage of antenatal and postnatal care, and even suggesting that neonatal mortality itself might be affected as a consequence of this improved coverage due to the implementation of digital tools. So the bottom line is I think we live in very exciting times. And even our global health leaders, such as Tedros Ghebreyesus here, who is the new DG of WHO, has identified digital technologies as a major reason for optimism. So all of us who are meeting in the room are not only supporting the same visions that you mentioned. Professor Azad was one of the early pioneers in this space, but also the fact that this is now enshrined in a World Health Assembly resolution that digital technology should be integrated into health systems infrastructures to reinforce national and global priorities. Over the past several years, we've improved how we speak about digital health, how we think about digital health, providing clarity to the words we use when we talk about digital innovation, such as this matrix of different flavors of digital health, if you would, so that when we speak about what we're doing in this space, there can be clarity across the board, whether we're talking about in-country innovation or the descriptions we use when we talk about digital health solutions. I think these tools really help national strengthen health systems. I'm thrilled to be part of the launch this year of the first ever WHO guidelines recommending digital health interventions for health system strengthening. And as you can see here, there's a list of topics that were struggled over by experts in the field who did exhaustive reviews of the literature to provide recommendations. And across the board, each of these has been recommended as a space where digital health can augment everything from birth and death notification to client communication via mobile devices and digital tracking of patients' health status. Bangladesh is in fact employing digital health to strengthen almost every single one of these domains that is listed in the WHO guidelines. So congratulations on those accomplishments. Zaki also mentioned the principles for digital development, and I think these have really been embraced by the global community as essential components of ensuring scalability at the national level. These are available at digitalprinciples.org, and many donors, governments, and implementing agencies have joined together in embracing these principles that are fleshed out in much more detail at the Principles for Digital Development site. They stem from frustration in discoordination and a lack of advanced planning for scale, and I will say really unthoughtful investment by a large number of donors that have really looked at broadening the use of digital health without necessarily embracing the need for careful advanced planning for scale prior to launching digital programs. The most important one to me in across these principles is really designing with the end user. And I think this is where we still struggle to make sure this is the case for many digital health programs that are trying to scale. Human-centered design is a concept that our colleagues at Empower and other groups across the country and globally have increasingly begun to use as a central tenet of the work they are doing. But it's really important to engage not only the payer, the person who is footing the bill for the digital health program, but also the user, and to make sure that the users and the beneficiaries ultimately receive a tool that works with their expectations, so that we can sustain and scale this in the long run. It's important to understand and appreciate as well, because the game of scaling up and sustaining programs is a continuous process and requires robust assessment and planning. WHO and we worked together a number of years ago to release the MAPS toolkit, the mHealth Assessment and Planning for Scale tool, which looks at 6 different domains of scalability, beginning with the groundwork, the scientific basis for the digital health intervention, the partnerships that are involved in the project, the financial health, both current and future, of the digital health initiative, technology and architecture. Is it interoperable? Is it scalable? Has it been developed with a concept of diversification in mind, that use cases can be added as the complexity grows? Operations, are the human resources required to sustain a program available within the project? And of course, my favorite is monitoring and evaluation as a researcher, to make sure that we understand the impact of our digital health investment, to further investment in that domain, but to also learn from not only what is working, but what is not working as we scale up. This toolkit goes through 5 layers of scorecards, which can be done very easily by program implementers or leadership, where you add up the scores for each axis, and then you calculate an axis score, as shown in this image. At the end of the day, you're left with a scorecard that can be used to assess your progress in scaling over time. It's also important to study and learn from others who have tried and succeeded. And then, as way we learn, we also must learn from failures. And I think Bangladesh and other countries have been very positive in really harnessing the lessons we learned from investments that have not delivered the things we wanted them to, so that we can move forward with greater success. There are communities of practice across the globe: the Digital Health Network, the Asian eHealth Information Network, the African Alliance for Health Network, and even in Bangladesh, the HISP group has put together a large community of practice from whom we can learn not just what's being done in our country, but what's being done across the globe. There are numerous strategy documents, this one from the Digital Impact Alliance, that will assist you in developing scalable plans. And I recommend for everyone who's on this webinar, that these tools really deserve a closer look and can enhance your thinking as you plan your scale up. A few years ago, we did an analysis of mobile technology in support of frontline workers. And one of the things we really understood was that the complexity of scaling up, I'm sorry, there's another hot microphone. The complexity of scaling up in terms of procurement, distribution, financial management, everything that really was not digital is also important to pay attention to. Supervision, incentives, and these were some of our key informants who weighed into some of the gaps in this space. The other thing that we noted was that there was what we like to call a enterprise chasm. So we noticed around the world, and we studied 12, 15 different countries looking at scale of digital technologies, we found a large number of small scale projects, but very few large scale projects that had really gone to national levels, because one of the things we noted was the complexity of these small projects was often too great to allow them to scale. And so you'll see here the word single feature is noted. And I think that really points to the importance of parsimony or simplicity as you try to scale, adding complexity as you continue. I do want to point out that scale is not only about the digital innovation, but over the past 5 years, there has been increasing appreciation about the importance of the ecosystem in which digital technology is trying to grow. The way I like to compare this to is when we plant seeds in the soil, unless the soil is fertilized and the soil is capable of sustaining that seed, the seed will never grow beyond a small sapling. And so we have to also, as a government and as investors in digital technology, pay attention to the policy and regulatory environment, the telecom infrastructure, the electrical infrastructure, and the human resources who will be the digital health enabled workforce of the future. In many cases, Bangladesh is a prime example because of its tremendous national infrastructure, the 4G and hopefully in the near future 5G infrastructure that will be available to piggyback onto to leverage digital health. But I think there are still patches of the country and countries who are on this webinar where the penetration of digital technologies or digital networks is still low, and electrical grids are still working to get up to speed. There are a number of implementation guides that are available as you think about scaling up programs in your respective countries. And WHO, PATH, and a number of partners are about to launch this planning and costing guide for digital interventions in the next few months. So stay tuned to see a costing guide that works with ministries of health to develop health program strategies according to globally accepted standards, thinking through not just the technology, but the health system challenges that you're trying to solve. This is the overview roadmap that is just hot off the press, showing the process which this toolkit will be using, all the way from forming the team through identifying the challenges to developing a value proposition and a costed plan to present to the Ministry of Finance or to a development partner. So I will say a vision is good, a strategy is better, but a costed roadmap is great. And that's when you're thinking about scaling digital health, a thoughtful, budgeted, planned program is really the best target of where we're trying to go. I like to use the example of the recent Tanzania digital health investment roadmap, which takes us to 2023, but really looking at not just the digital health interventions themselves as separate programs, but also what are the investments that will be necessary to build the infrastructure, to build the roads and highways on which digital health programs will be running. So when we think about this continuum from need to strategy to funding to implementation, there's both the need for technical capacity, but also political will and leadership. Both areas which this focused country, Bangladesh, has in large capacity. And I think it's been instrumental, as you mentioned, not only Professor Azad, but also the highest levels of leadership at the Prime Minister's office also support the vision of digital health and digital Bangladesh. It's the reason why Bangladesh's accomplishments in this space have been celebrated so dramatically over the past several years, going all the way back to 2011, when the Prime Minister received an award for Bangladesh's achievements in the digital sector. So I'll leave you with a few last thoughts. The investment in enabling architecture. There's now a global digital health index, which I recommend any country on the call who has not gone in to this tool to complete the questions relevant to understanding the ecosystem of readiness for digital health in your country. Please go ahead and do so. It will help us to understand regional levels of accomplishment as well as progress that's being made over time. As you can see here across the board, Bangladesh is actually quite advanced in all of the essential building blocks that have been identified by WHO and ITU as necessary for enabling digital health progress. Things like a shared health record, here described as an open health information exchange, is an investment that the government of Bangladesh has been making to prevent things like pilotitis. And some of you may be aware of this term. This is a map of Uganda about a decade ago, showing discoordinated investments in digital health, none of which were speaking to each other because of a stark lack of coordination and interoperability. So things that investments in a health information exchange can really strengthen. I also encourage all of you to go to the WHO Digital Health Atlas, because there's nothing that helps government more than looking at the landscape of digital tools that are already being used in a country to strengthen cooperation and to prevent the reinvention of the wheel. And I think as we look here, there are certainly more projects than 7 in Bangladesh doing digital health. There are more projects than 5 doing digital health in Nepal. So we need to accelerate our contributions to this important document that is available for free on the web. There are also global goods that have been invested in to help prevent wheel reinvention. And Digital Square is a global forum where you can go to find whether there's already a technology, whether it's an SMS gateway or a tool for frontline workers that has been vetted, tested, and approved by the global community and the donor community to make sure it meets the standards of robustness and interoperability expected by the principles of digital development. And these are available at digitalsquare.org. Finally, I'll say we must not ignore the importance of measuring impact, because as we measure impact, we can drive investment, because the value that we demonstrate as a Ministry of Health to demonstrate to the Ministry of Finance and other development partners that these digital investments are not only improving efficiency, but they're also saving lives, will ultimately result in greater funding in those programs, making them scale and more robust. There are a few challenges we have in hand, including that of universally identifying our patients and clients as we provide services and ensure coverage. We have to be able to capture a denominator, and Bangladesh has made significant headroads in coverage of national identification. But we also have to explore things like biometrics, not only for adults, but for children and infants, for coverage of essential infant and neonatal services, such as vaccinations. We also need to bridge the gap of gender. And as you see here, women in South Asia are 38% less likely to own a mobile phone, according to GSMA. And South Asia actually has the largest 38% gap in gender equity when you compare it to other LMICs across North Sub-Saharan Africa and East Asia. Something to work on. We also need to engage the private sector, and I think this is something that we still haven't found the perfect solution for, but I think in Bangladesh, you can see here just by the logo soup at the bottom, the large proportion of innovators that are working in this space, delivering care in close collaboration with the mobile network operators. At the very end, I'd like to say that the importance of scale, and I'll quote here from my colleagues at UNICEF, to recognize the political historical context within which these digital systems perform. We have to understand the perceptions, attitudes, and needs of the stakeholders and design interoperability into the systems at the beginning, and something that we're beginning to do more and more across the world. And with that, I will just say, building for scale is not simple, it's not cheap, and most pilots were not built to scale. It's exciting to see the way government has been engaged from the very beginning here in Bangladesh, and has been closing the data loop by providing data back to the workers, back to the supervisors, to enable them to perform better programs. I think working together, we can scale solutions that benefit everyone. And with that, I want to thank you all for this opportunity, and I look forward to a long continued collaboration with colleagues in the Ministry of Health in Bangladesh and across the countries represented here on this webinar.
So I think I would ask Dr. Alain Labrique to give a concluding remark, because we are at the end of our time for this webinar. And if Alain would like to give a little bit of finishing touch in our webinar.
No, so, thank you for that. I think Dr. Chengo, I think you had a Herculean task, and you performed it beautifully.
Thank you very much.
To summarize, the African continent is something that's quite challenging. The rest of us had one country. So I think, I'll conclude by just saying a few things. I think one of the key things to remember is that at the heart of what we do is health. And we're trying to solve health problems, and sometimes the appropriate solution. Yes? Hello? I'm getting the T sign. I don't know what that means. Zaki is frozen, so I'm not sure what's going on. You want me to continue? Can you hear me, Dr. Chengo? Hello?
Can you hear us? We can hear
you. Did we lose you?
I can hear you.
Okay, you're frozen like this, so I'm not sure what that means. I thought you meant to stop. So anyway, I was going to say thank you so much for the opportunity. It's a pleasure and a privilege to be on this virtual stage with such distinguished colleagues, and I think fellow strugglers on the pathway to find solutions. I was going to say at the heart of what we do is solving health problems and healthcare delivery challenges. Sometimes the correct solutions will be technology-based. Sometimes they will be based on strengthening human resources, strengthening training, strengthening capacity, and strengthening information. We must not become sort of enamored by technology for technology's sake, because I think that has been the challenge that we learned from many years ago. We have to remain problem focused. So whenever we're talking about technology, I think the bottom line is to always ask ourselves, what is the problem that we're trying to solve, and what is the role of technology in the space? I think our distinguished speakers from Bangladesh, raised a number of elephants in the room, and I think, part of what really has distinguished leaders in the field like Professor Azad and like those who are on the dais today is that they are not afraid to recognize the elephants that are in the room. I think the recognition of things that work is fantastic. We love to celebrate success, but we must always be open to discuss what does not work. And I think being frank about failure and being frank about what the shortcomings of our digital health investments are has absolutely been at the heart of Bangladesh's success in digital health and the success of countries like Zambia, Rwanda, Tanzania, and other East African countries. I think there are important public health gaps that remain that will not be solved by technology alone, including the workforce gap that remains to be filled. When one of our colleagues from Bangladesh mentioned 160 million people, and we do not have the army of frontline workers, even with the large number of workers that we need to sufficiently provide not just high levels of coverage, but timely coverage of antenatal care, postnatal care, immunizations, etc. So we have to try to focus to work smarter and provide timely coverage of services. And finally, I will talk about the importance of not just incentives for performance, but also consider the threats to why systems aren't working. What are the disincentives to information transparency? For 3-4 decades, we have enjoyed the relative obscurity of not having information transparency. But when I can see health worker information on a daily basis in real time that is a real and present threat that unless we make the workers understand that we will not be enforcing them with sticks, but mostly carrots for good performance, we desensitize the level of threat that they face in complying with these new digital systems. They have never been under surveillance or under scrutiny like they are now with digital technologies, and we have to be able to reassure them that good data isn't accompanied by punishment. And lastly, I think Professor Azad has a great philosophy that, you know, data is better. Some data is better than no data, and even imperfect data is a good place to start. And so I think some of the challenges that many of the people on the webinar might face is the concern of looking at data that is perhaps incomplete or imperfect. And I think you have to acknowledge that that's the place to start. Once people start to see data that is incorrect or doesn't coincide with how they think they are doing, that will drive them to improve the quality of data that they are submitting. So don't be afraid of data, embrace what it says about what you're doing well and what you're doing poorly, and use that as an opportunity to get better. And, you know, our distinguished colleague mentioned, you know, the importance of people not wanting to share or work together because of the perception that they will not be recognized for their individual achievement. I think that's a threat that's part of the human ego, and we need to figure out a way that you know, interoperability and cooperation doesn't mean that you will get less recognition. And so we must celebrate everybody's success, but that means we must work together. So it's been a really great webinar. I'm so privileged and thrilled to be part of this august group, and I look forward to many more conversations as we improve our trajectory to universal health coverage. Thank you very much.